Welcome to ThinkTech here on Ustream and also Spreaker, broadcasting live today. This is a very important discussion because it involves an event which is going to take place pretty quickly on Thursday. And our guest today is Steve Robertson, Executive Vice President and CIO of Hawaii Pacific Health. And if you didn't know it, Hawaii Pacific Health has a handful of hospitals, a large handful of hospitals. As a matter of fact, when you take them all collectively, HPH is the biggest health provider in the state of Hawaii.
Right. We take great pride in that. For the moment.
Okay, and we're calling this show, this is our Tuesday at 2 p.m. slot, we're calling it Finding a Future Healthcare in Hawaii. And the reason we're calling it Healthcare in Hawaii is because we have a program by the same name that we are producing with the Hawaii Venture Capital Association on Thursday at 11:30 in the Plaza Club, where we're going to have, first our moderator will be Ginny Pressler, who is also a senior in Hawaii Pacific Health. She'll moderate a panel of 6, and Steve Robertson, our guest today, will be one of the panel of 6. Hi, Steve. Thanks for coming down.
Hi, Jay. Good to be here.
It's great to have you here. We appreciate that. And we want to use this opportunity to discuss not only the program that's coming up, but also what's going on in healthcare in Hawaii to sort of get a handle on things, sort of the homework before the test.
I was never very good at homework.
Me neither. So tell us your perception of what's going to happen on Thursday, and we can share our comments about that.
Okay. Well, actually, the state as well as the country is going through a pretty major revolution.
Excuse me. Just get the microphone on you. It'll be so much better if you have the microphone on.
So I should have done it.
Yeah. Okay.
Okay.
Yeah.
But the state of Hawaii and actually the country is undergoing a major revolution. I mean, as we all know, we read about it and we see it on the news every day. But you hear this term called accountable care, and what that's really driving us for. What it really means is that the country is now at a position where we can no longer sustain the current growth rate in our expense structure for spending on healthcare. We know that's unsustainable. The country provides the best healthcare in the world, really, but we need to find better ways to do it so that we do it with basically more cost effectively while we're still really driving up improvements in quality care that we provide. And the country has reached a point where we all realize that's absolutely possible. You know, we've got the best doctors in the country, best hospital systems, the best supporting technology, but now we need to really start working differently. And that different really comes down to team care, partnerships with our patients, with our physicians, getting ourselves together, working collaboratively in ways that we've never been able to do before. If we can do that, it will make things a lot more efficient. There'll be, for example, just health information exchange. I know you've had Christine Sakuda on the air before talking about that, but our ability to reduce the number of diagnostic tests that we give, that reduction in duplication, so that if you're a patient and you see one doctor and you go see another, that next doctor will actually be able to immediately access your information and have a good, clear picture. But also from the patient point of view, because there's nothing more empowering than you having access to your information, being able to see how it applies to you. Because there's nothing more interesting than ourselves, right? I mean, I remember when, this is probably a slight tangent here, but I remember what a wonderful thing it was when you could go pump your own gas. So now when it comes to your health care, you're going to be able to take more control as well. You're going to be more of an active partner with all of the, without, today, in the past at least, it's been hard to do that because all your information would sit in a paper medical record someplace and either maintained by the hospital or by the clinic, and usually in more than one location. So now having all that information immediately available to those who need it, especially the patient, you're going to be able to do a lot better. And then you just tell me when to shut up.
No, I want you to, because I'm developing all kinds of thoughts I want to express when you're done.
All right. But so now you add on top of that these newer technologies that enable you to collect more information about yourself. So, for example, there's newer technologies that you can wear. That actually, I bought one. There's one system that you can actually buy to strap to your head. I won't mention the brand unless you want it.
Sure, no matter. First Amendment, yeah.
I don't want to give anybody free advertising here,
okay.
but it's a company called Zio. It's a headband that straps to your head, and then it tells you what kind of sleep you're getting at night. So it'll tell you if you're in REM sleep or light sleep or a deep sleep.
Or you have apnea.
That's exactly right. It's kind of a cheaper, kind of the homebrew approach to going to a sleep clinic.
Yeah, which means you got to spend the whole night at the hospital and all that.
That's right.
So,
and who's going to sleep well there, right? But there's some health conditions that are aggravated by sleep apnea. If you do that, and let's say if you're a diabetic, the technology is getting so advanced now, just with a Bluetooth connection to your PC, you'll be able to automatically log that information and be able to share that information through your portal, basically an online portal into your medical record. So if patients can see what kinds of progress they're actually making, even with Fitbits, right? We've all heard of Fitbits that also give you an idea of what, how active you are during the day, you know, whether or not you're meeting your exercise targets. A patient who can actually log into a PC and track that stuff gets that immediate gratification of accomplishment about what they're really doing with their health. And by being able to communicate directly with their physicians online or to the clinics, that really fills the three-legged stool in terms of patient care. And you know, one of the jokes you're going to hear about here is, you know, we all talk about accountable care. Well, accountable care will really, when doctors hear that, they're usually not too fond of the phrase, because of course they're accountable, and they really are. I mean, they really are there to provide the best possible care. But when we talk about accountable care, we mean accountable to the team of providers, not just the physicians. And but I've also heard a physician once joke that accountable care means accountability for everyone but the patient. Okay, so when you look at the incentives, you know, if you have a patient that's not going to manage their diabetes or watch their blood pressure, things like that, that really limits the options of really being able to improve that patient's care. And it's our hope, Hawaii Pacific Health, but also other systems across the country, that we're going to be able to provide those tools to really engage the patient. And actually, even in our clinics, and mainly in our clinics, we've been able to really be very successful in doing a very effective outreach to our patients and get them engaged that way. And it's why when we measure ourselves, and another good thing with having all this information is the accountability comes in, because we can actually measure how well we're doing. You know, we can actually measure the health of the patients as a whole to ensure that we're providing the right kind of care at the right time. So it's all that teamwork enabled by technology. So what we're doing today, see, Jay, I'm not going to let you talk here.
It's okay. I love every moment of it. This is great stuff.
Okay, so what we're seeing today has been compared to what the Gutenberg press did in terms of just information. So, you know, when the press was invented, it enabled everyone to have access to books, to be able to see information. I got to credit this to Dr. Eric Topol, who's somewhat of a futurist in the field. I think he works at Scripps. But now with health IT, the information now leaves the paper medical record sitting in the clinics and becomes available for much bigger, broader things. And I've got to talk about this a bit, but at Straub Clinic and Kauai Medical Clinic, it's okay if we talk about our facilities,
sure.
Right? We have a dedicated outreach team that focuses on reviewing patients with chronic diseases and then ensuring that they're getting all the care that they need. And, you know, sometimes we as patients, we don't always do what's right, right? First of all, I know me, I don't like going to the clinic and seeing a doctor. But when I get an email reminder telling me that I need to come in for something, you know, that's always a prompt. And even if I'm a diabetic, for example, and I'm overdue for an eye exam, maybe I'm not going to do that, or a foot exam. But you'll get the reminder in your patient portal once you log on. But then if you go to, let's say, get your flu shot or whatever it is, we will actually target you as an individual so that we have the right staff available to you at the time of your arrival to make your experience as convenient as possible, so that you do get the other shots that you need.
This is now?
This is right now, yes. It's still not as broad as we would like it, but we're getting there. And actually, we're working with HMSA, but also through our own accountable care organization eventually through a new company called Hawaii Health Partners that will really begin to focus on
That's
this.
one of your affiliates.
Yes, it is. It's a new company. The board of directors is only just now being formed, so it's probably too soon to really be talking about it, but it's our goal to, we know as a health system, 4 hospitals, 49 outpatient centers, that we can't do it all ourselves. The real success to all of this comes with our physician partnerships in the community. You know, not the ones employed by Hawaii Pacific Health, but the bulk of the practices, which are independent physicians operating in small practices. Those folks are the ones that really can transform everything to do with healthcare if we all work together as this team in partnership.
Well, wow. Thank you for the great opening. A couple of questions come out of that. It seems to me that when you say accountability these days, and it goes to pumping your own gas, is the patient now not only can be, not only should be, but has to be more accountable for his own health. Why? Because the technology is there. It doesn't take a rocket scientist to use the technology, and he can get a certain baseline of information, in fact, diagnostic type information, himself, using this technology. So you're the CIO, you're right in the middle of that. You're right in the middle of all these information technology things you were describing. You have the dream job of the Western world, maybe the whole world.
Jay, that is really true. It's by far this is absolutely the best time to be in health IT. I feel like I'm made to do what I'm doing today. I feel like we are really on the crux of a major revolution, and health IT is right in the middle of it. It really is. But I am a true nerd geek, at heart, and I tell you, if I could have multiple devices strapped to me in some Borg-like fashion, that would measure my triglycerides, my cholesterol, my, whatever profile I wanted, and then I would absolutely sit there and plot it out, and I'd interact, and I would really try to crank down on those variables. And I think that, I know we're not all like that, but I think by keeping it simple, like even a Fitbit, that's a very simple device, very easy to use, is really going to transform everything we do. And I feel like I'm blessed. I'm very blessed to be here.
So but the other thing that I take away from your, comments is that people they're not up to speed on how fast the industry and, the whole dynamic of medicine has moved. They don't really understand. They're sort of back there 10 years ago or more, trying to get the doctor to tell them everything and not using the technology, being a little put off by being asked to use or offered to use the technology. And then along comes the Affordable Care Act, which is a system of great complexity, basically unknown and maybe unknowable in some ways. And just as the patient must adopt the technology, understand it, use it, bring it in for his own benefit and understanding of his own health, so the patient must understand the system, because the system is changing and it will affect him. So that's why this program, theoretically, right, on Thursday.
Right, yes, absolutely. And I think we'll provide a lot of insight into the challenges as well.
Yeah. Well, just give me a rough idea of, what I might plan to take away from this program in general. What should my expectations be?
Your expectation should be that healthcare really is fundamentally changing. It's not just a lot of rhetoric. There are things that are already occurring and have been occurring even before the Affordable Care Act. That everything is going to be okay, especially here in Hawaii. That we're all going to get improved care, and the increases that we've had in the past on cost and expense will not be rising as rapidly as it was. That we're going to be a lot more efficient, and we're going to be able to engage our patients in a way. If we're really doing our, I know I'm on a sidetrack again.
I hope you know what you're saying now is being broadcast, right?
I got to be careful here. No secrets. But I think, when we talk about the patient engagement piece, I just have to interject this. It's just that we as a healthcare system need to do more to make it easier for the patient, because you know, in the past, just trying to have a normal conversation, you know, in plain language about what the problems are and how we're going to help is always a challenge, but we can do it. And that's why you're seeing bigger, broader investments in terms of educational materials and interactive tools as well. But
we're going to take a short break, Steve.
okay.
I have to sort of digest what you've been saying, reorganize ourselves, and move on to the next part of our show, which
Okay.
will be sort of drilling down on exactly what people should learn about and how they should change their thinking, such as what we're going to discuss on Thursday. So for now, we're going to take a brief break. This is Steve Robertson, Executive Vice President and CIO of Hawaii Pacific Health, the largest healthcare provider of the state, here on the ThinkTech series, Finding Our Future, Healthcare in Hawaii. We'll be right back. Great question line. We're back. We're here with Steve Robertson, Executive Vice President and CIO of Hawaii Pacific Health, on Finding Our Future, Healthcare in Hawaii. We're talking about the Healthcare in Hawaii program that's going to take place on Thursday at the Plaza Club, where ThinkTech collaborates with the Hawaii Venture Capital Association. So far, our registrations are very robust, and we expect it'll be a great program, and Steve is part of it as a member of our panel. Also, Ginny Pressler is the moderator. She's also from Hawaii Pacific Health. Well, you know, I guess what I get is I'm responsible for my own health, and I have to study these things. And nobody in the world, not even the best doctor in the world, cares as much about whether I live or die, theoretically. I mean, some people, there are exceptions, but you know, have a nice day unless you've made other plans, right? but in a general way, I mean, nobody is as concerned about your health as you are. It's your life. And so we have, further to your remarks a little while ago, we have the exquisite opportunity in the 21st century now here. It's a great time to be alive. And you can really capitalize on being alive these days. We have the opportunity to actually make ourselves individually more healthy, live a longer, more healthy life. Isn't that a wonderful thing? We can control it. And if we don't control it, and if we ignore this huge opportunity, we're really silly, because we're not going to live as long, we're not going to be as healthy, we're not going to be able to deal with the ravages of age and disease and whatever else comes down the pike. So this program, I mean, not to say that it's important, it's very important. This program can actually help us do that. Not only the technology,
Right.
but the system.
Yeah.
So what do I need to know? What are you going to tell us in your share of the program about those things?
You know, a couple of things. One is that first and foremost, we as a health system can do better, and we will do better, and we've already made progress and are making progress. But I think also, when you listen to the show, it's natural for all of us to say, well, how does that really affect me personally, and how does it apply to my business or to my family? And so you're going to hear about a lot of talk about the health connector. Okay, basically, It's an approach to be able to bring competition into the insurance marketplace that enables people to have more coverage. So
Can we reel it back? What is it?
Okay.
What is the Health Connect?
Yeah. What you're going to hear is there's a movement afoot. If all this works according to plan, that there'll be an insurance marketplace that will be online. So, for example, if you don't have coverage but you want to get coverage, so under the Affordable Care Act, everyone has that opportunity to get coverage. And some of it will either be subsidized at the federal level, or you'll have reduced payments based on your ability to pay. So it's good in that it will reduce the rate of uninsured people in the country, and puts in, as we know, pre-existing conditions and things like that aren't going to be barring you from getting it. But the connector allows you to connect with the ability to buy insurance at a very reasonable price.
More reasonable than now? More reasonable than HMSA, for example?
I'm not going to talk any further now. Yeah, because yes, it's possible. And again, it depends on how much you can afford and what you qualify for, either under Medicaid or not. So there's online real-time eligibility checking in terms of what you can qualify and what your rates will be.
So it becomes a marketplace.
It does.
A free market. Relatively speaking, it's a free marketplace.
That's right.
And you can have entries by insurance companies with various different kinds of policies and terms that maybe will suit you better than the products that are available right now.
Yes.
This is big.
It is big. It's a mammoth undertaking.
But do we need it in Hawaii? Because we have a pretty good system.
We do.
We're ahead of the country.
We really do. We absolutely are. And that's why we get cited as examples for the rest of the country all the time, right? But our uninsured rate is only 8% right now, which is pretty good. But even 1% may be too high, right?
Yeah.
So so do we need it? Yeah, we do need it for the 8%.
Which could grow in the future. I mean, in tough times,
yeah, it could.
Times of recession, that 8% undoubtedly grows because people just can't afford it, and so they go without.
Yeah. Yes. But with the Prepaid Healthcare Act, that gave all of Hawaii a definite, distinct advantage in keeping that uninsured population down.
Well, the other thing too. I mean, people talk about this too, is that if you have 8%, even as little as 8% out there that's uninsured, that's a drain on the system. Because if they walk into your emergency rooms, you as a Samaritan issue, you really, right? As a human sympathy thing, you're going to take care of them.
Yeah, plus,
and you may lose money on it.
And I think most at least hospital systems in the state are not for profit. So that's what we are, not for profit. So we're going to see every patient that comes through our door. We're going to provide them the right care. But eventually, that care has to get paid for. So we do it either through philanthropy or fundraising of some sorts, or we have to negotiate higher rates with some of our commercial payers.
This puts pressure on. I mean, for example, we've had some hospital failures, which I mean that's a bad thing to have hospital failures.
It's had a major effect on every facility in the state.
Yeah.
It really has.
Puts more pressure on the other guys. And then if the 8% goes to 10 or 12 and you feel obligated, on a moral level to take care of people who walk in the door and they're sick, that puts more pressure on you. You wind up eating more of it, I think.
Yeah, that's right.
And,
but there's also a dark side to it all too, because a patient that doesn't have insurance is probably going to wait to the last minute to get care.
Yes.
So now they're ignoring all the preventative care, all these patient engagement things that we're talking about.
Accountability.
That's right. Yeah, and then they show up in the emergency room and then they get admitted. Emergency room visits are very expensive, and if we can, Hawaii Pacific Health is really attempting to reduce the number of ED visits by opening access to primary care, working in partnership with our independent physicians, but also focusing on just preventing readmissions. So a really complex patient that gets admitted needs special care so that they don't end up back in the hospital. And in the past, and that's kind of the fundamental change, that's really the crux of all of this, is that in the past, systems, when you look at the incentives, you actually get paid more for patients that were being readmitted, or maybe you'd actually want to encourage, not that we would, or anyone would, but the more ED visits you have, the higher your volumes and the more your revenue. It's very perverse. Mm-hmm. So systems working together to ensure the incentives and the reimbursements are appropriate to be able to provide that care that we really need to keep them out of the hospitals, to reduce the ED visits. That's the thing that's really changing. In the past, that was really hard to do because of the difficulty in getting this kind of team care approach. And again, I've got to shoot in, information technology being one of the key enablers. That's what's really different with all this stuff.
The other thing about people who use the emergency room as if it were the primary physician, which is really not bad business, I mean, for everybody. Aside from costing the system and the hospital unnecessary money, they wind up being sick more because they're not taking care of themselves.
Oh, yeah.
And that has a secondary effect on the economy. So if I give you a system where every patient, every individual in the state has protection, has insurance, has accountability, thus has accountability, I give you a better economy. More people are productive. Isn't it true?
Absolutely. And actually, that's one of the key selling points. If when you go to employers, there's a big incentive to keep their employees at work. Otherwise, you take productivity hits. You're calling in people to take their place because they're not there, because you need the services to be able to be provided. And so if you can really focus more on the preventative care aspect, but also enabling sort of maybe after hours visits into clinics to see
Sure.
Physicians and really get the kind of care that they need, so they don't have to go during office hours.
Yeah, one thing you mentioned on the technology level, I think it really touches me, and that is, as doctors have gotten busier and as their paperwork burdens, and we'll hear about this in the program, as their paperwork burdens, especially the solo practitioners have grown, they have less time to actually talk to you, to mano y mano, which I think is so valuable because, who else can you talk to about your personal stuff? And so, to me, we have got to let that person have that access. And that will be better for everyone if we can do that. But the doctors are so busy they can't take your call. A lot of them do not respond to email. HMSA came up with this program a couple of years ago where we can get on a website and talk to a doctor. I don't know how well that's doing. But there ought to be, and you mentioned this, there ought to be like a email access. I should be able to email my doctor and say hi, and I got something that bothers me. What do you think? And there's no reason why he can't answer me. I think a lot of doctors are afraid, and they're going to say something in the email. It's going to be Exhibit A, some claim. We have to get away from that way of doing business, and we have to allow the access, don't you think?
I really agree, but the approach that we're taking is that the we being Hawaii Pacific Health is that we need to be able to give the tools to our physicians, and then be able to provide them the resources so that they can, quote, work to the top of their license. So if we can just remove the administrative burden, get all this stuff out of the way that maybe they're doing today, that just prevents them from interacting with patients, then we're all going to do a lot better. And so part of the approach, for example, is that that we put physician extenders in the clinics, or we do outreach staff in a centralized way to sort of take care of all these things. Of course, it's never going to be perfect, and I got to tell you, moving from paper records to electronic records did not reduce the physician's workloads at all.
No.
Actually increased it.
Not in the
pretty significantly.
Transformation, maybe later, but not now. But maybe later not either.
I think, and I'm going to try to channel our physicians, or the ones I talk to.
Before you do that,
okay,
we're going to take a break.
Okay.
And that way people can do a cliffhanger on this because they need to know about this. How to deal with your doctor. You heard it here on ThinkTech, Finding a Future Healthcare in Hawaii. Steve Robertson Executive Vice President of Hawaii Pacific Health, the largest healthcare provider in the state, and also CIO, which is the part that is especially interesting to ThinkTech. We'll be right back after this break. Okay, we're back. We're live. We're at ThinkTech on finding our future healthcare in Hawaii with Steve Robertson, Executive Vice President of Hawaii Pacific Health, and also the CIO there. We're talking about the program by the same name, Healthcare in Hawaii, that ThinkTech and the Hawaii Venture Capital Association are putting on at the Plaza Club this Thursday, June 27th, which we are looking forward to it. Steve is a principal player in that program. Steve, I'm sorry I interrupted you before for the break, but can you continue in your discussion about how we can facilitate access between doctors and patients?
Yeah, I think the cliffhanger was that going to electronic records has actually increased physician workloads. No, absolutely no question about it. Long term, I think that we're all hoping that that pressure sort of dies down a bit, but right now, for example, because of all the billing requirements and coding requirements and everything else that goes into it, physicians have essentially been, there's a lot more expectations, unfortunately, for them to document things that they might not otherwise do. Just to be able to support the claim that's being sent to Medicare or Medicaid or any other place, just for that financial accountability piece. So, but there are other great benefits. So, for example, physicians now don't need to drive in to the hospital to look at a paper record. They don't need to come in and actually see an X-ray. They can log in from home. They can check it out, and it's having a profound impact just on that coordinated care, being able to provide that without inconveniencing the patient and the physicians at the same time. But it's our hope that we can start to mitigate some of that burden, again, through the addition of medical assistants or physician assistants or licensed LPNs, RNs, the staff that can really go in there and maybe offset some of that burden that the doctors have, which we talked about. But again, technology is the only way to do it.
Yeah, but as you bring more technology online, you need people to operate the technology.
Yes.
And not only the patients, but the system. And as you do that, you have more people with more answers, more problem-solving machines and software. And so the role of the doctor changes, doesn't it?
It really does. The doctor becomes the orchestra leader.
Yeah.
Not the one blowing the tuba or somebody else.
Thank you for that.
Because in the past, and it's still true, doctors do it all. They really do. I mean, you know, they're a one-stop shop. You know, that's why they're trained to be able to solve the problems at hand and do everything. It's just an impossible task that we ask.
Yeah.
You know, I was looking at a study that was done, I think years ago, but they were predicting that by the year 2012, that there would be 1 million articles, medical journal articles, published every year, and that it was impossible for a doctor to keep up with that. And during one of the studies, the study was done with an epidemiologist, and what it would really take for that epidemiologist to really stay current. And they estimated, these research librarians estimated that the epidemiologist would have to read articles for 21 hours a day just to stay current. So it's really critical that we continue our current route of making these systems intelligent so that it assists the physicians in being able to provide the best possible care based on best evidence. And that level of integration does exist today, for example, within Hawaii Pacific Health and Kaiser and Grants, you know, basically anybody with electronic health record. But we can do even better because we can take it one notch further. And you know, we're not going to talk about this on Thursday, but it's really critical, so I'm going to jump right into it.
Okay, I want you to.
Is something called predictive analytics. Predictive analytics. So just imagine it's sort of that Maslow's hierarchy or evolution of where we've really been. So we're on paper records. Now we've got electronic medical records. Now we use that information to be able to do patient outreach and focused intervention to really improve their care. And now you take it one step further and you get into analytics. And analytics is the absolute future of healthcare. And what I mean by analytics is that if based on the information that you have, you can identify patients on certain medications or certain conditions or certain this or certain that, you can actually predict when they're actually going to need an intervention. So if nothing changes with this patient's current biostatistics, weight or blood pressure, you can predict what kinds of problems they're going to have. And then you align your clinic and hospital resources to go really focus on those kinds of, you know, to be able to prevent that. So it's, you know, what our real goal here is, ultimately, you know, we want to be laying in that Star Trek bed with, you know, the monitors that are
Fix
there.
anything. Well, but taking it a step further, a friend of mine told me yesterday that he had sent away a little spittle, and he sent away a little spittle, and for $99 they made a DNA analysis for him. They told him predictability on what kinds of, you know, diseases and problems he would have the rest of his life. And, you know, it seemed very authoritative, and I'm sure that it's good now, but it's going to get better in terms of the accuracy of the prediction. So take that and factor that into what you're talking about.
Okay.
And then I present with a symptom, and you can connect up the symptom or the blood test, whatever it may be, and say, oh, looks like you have a 97% chance of this and that, and then go look against another database on treatment and come up with a presumptive treatment. That's amazing, isn't it?
It really is. It's all going to come together because, you know, maybe some of these invasive or some of these screenings that we go through, you know, if you don't have a genetic disposition for that, maybe your genome doesn't quite map that way, or, you know, or other factors that come in, then maybe you don't need that. Maybe that will reduce costs, or maybe you need something that you wouldn't have gotten otherwise.
Yeah. So you have a much higher chance of hitting the mark first time, a much higher chance of knowing the problem, being able to deal with the problem in a way that's specific to you.
That's right.
God, it's nirvana. This is the fountain of youth you're talking about.
Actually, it really is. And you can take it even further. So for example, one size all pretty much fits medications today. Again, I'm not a doctor, so I don't know what I'm talking about here.
Information technology goes a long way toward being a doctor.
But you know, when you get prescribed medications, it's really, it applies to everyone generally. You know, but if you can adapt it to your actual, so maybe you only need half that medication because of your biochemistry, your biochemical makeup, you know, because your body's going to interact better with the medication. Or maybe it's not, maybe you need more, right? So that tailored, really moving in toward tailored medicine is where we're going to be there. You know, I've heard this too, and I know I'm making it sounds like I'm making this stuff up, but I kind of key on this, but I heard a doctor once say, and I don't know if he based it on anything, but if you can survive in good health and live 20 years, if you can arrive 20 years from now in good health, you're going to live to be 120.
Because in 20 years, they'll have all this technology.
That's
and
right.
It'll all be perfected.
Yes.
So how does the Affordable Health Care Act help us get there?
It helps us get there because everything that we're talking about is still based on team care. It's that coordination. It's that lack of silos. You cannot have innovation without integration. And it's that integration of the team and the patient that really will drive that innovation in a meaningful way. And what you're seeing with the Accountable Care Act and everything that we're going through is leading us in that direction, exactly.
Well, you know, I mean, it's great to be alive, but it'll be better to be alive for a few years.
Yeah, let's just hope that stem cell research really pans out, right?
I don't think people really understand the magnitude of this industry. I mean, there's many billions, hundreds of billions, I would imagine, involved in the cost of keeping it going and treating everyone who needs treatment. And, you know, seeing all the patients, the whole country effectively, and keeping the hospitals open and the clinics open and the doctors practicing, is millions and millions. I mean, there's, you know, 200 million plus Americans who need this, and some system has to bring it all together. Now that's complexity.
It is.
And so, you know, although there's criticism about the Affordable Care Act, the fact is it's the first time, am I right, we've had an attempt to make it whole, to make it one system.
Well, but I think, you know, when you look at the Accountable Care Act, though, a lot of these things actually began even before the Affordable Care Act, because we all realized, and this is particularly true for Hawaii Pacific Health, we all realized that it was unsustainable. You know, that we couldn't keep going back to the insurance companies demanding more and more and more, and that we had to reach a partnership. And the thing that's really going to drive the success of the program is the innovation that is going to occur through partnerships with our insurance companies, the payers like HMSA. So we've got a great partnership with HMSA today. They're helping us fund the things that we know that we need to focus on. And it's that kind of success that's really going to, you know, I'll even wager, you can quote me on this, but within 3 to 4 years, Hawaii will be leading in innovation for a truly accountable care organization, and multiple of them, but in partnership not just with Medicare and Medicaid, but with our commercial payers like HMSA and the others that are out there.
That'd be fabulous. And
Okay.
I can send email to my primary care physician and he will answer me.
That's right.
That too.
So you need a Straub doc, or you need, or a Kauai Medical Clinic doc.
Well, you know, that's coming. Those models really have been successful, and it's impressive what we have here.
You know, what we found too is being able to communicate with your clinic or your primary care physician actually reduced the number of calls coming into the clinic.
Interesting.
Yeah, so it was...
so you save all kinds of expense on that end if you allow communication on the other end.
That's right, and then you can provide better customer service because now your patient service representative in the clinic is going to be able to spend more time with you.
Yeah.
Instead of answering the phone.
We're going to take a short break now, Steve.
Okay.
When we come back, I would like to talk more about the program and who the people are on the panel. We can go through them, and you can give me a prediction of what they might discuss, and a little more on what you'll discuss, and your word of the day. We'd like to know about that.
Okay, right.
And we'll be right back after this break. That's Steve Robertson. He's Executive Vice President of Hawaii Pacific Health, the largest healthcare provider in the state, which always impresses me too. And he's the CIO there, which is the dream job. And we're here on Finding Our Future, part of the ThinkTech series, talking about healthcare in Hawaii, which is the same name as the program we'll have on Thursday, which includes Steve and Ginny Pressler from Hawaii Pacific Health, and which will talk about all of this in greater detail at the Plaza Club. You can sign up for that program at hvca.org. We hope to fill the house, so come on down. We'll be right back after this break. This is going to be really, really rich. Of course, you know, I don't know if we'll have time, but I'd like to know the dark side too. Okay, we're back. We're back. This is Steve Robertson. I'm with Steve Robertson. This is Jay Fidell, actually. I may look like Steve Robertson, but actually I'm Jay Fidell. And the fellow at my left is Steve Robertson. He's Executive Vice President of Hawaii Pacific Health and the CIO of that company. And we're talking on finding our future healthcare in Hawaii. And we're talking about a program that's going to take place Thursday of this week on June 27th about healthcare in Hawaii at the Plaza Club. So I want to take a minute to just go through the other members of the panel, Steve. So we have Matt Delaney. I would say he's a very visionary businessman, got a whole spate of a schema of businesses, many subsidiaries and affiliates, all about helping employers. So what do you think he's going to talk about?
Okay. Actually, when you look at all of our panels, because of their breadth, it's going to hit every angle of what we're really facing in terms of the Accountable Care Act. So one of the more critical players really is the employers in the state. So he's going to be very interested in finding out what it means to in terms of what the overall costs are for our employers, because as we know, just having a business in Hawaii is a huge challenge. Not only is our cost of living high, but we have other issues as well, and we really need to be able to keep those costs down. So it's going to be a great view from an employer point of view. What does this mean from a regulation point of view? What does the law require? What am I not thinking about that I should be thinking about? And what's it going to cost me?
Yeah, a lot of people are scared about it, so this will help alleviate that. Okay, Gordon Ho, he's the insurance commissioner in the state of Hawaii, and he knows this is a big deal, and he's taking a lot of personal time and attention to make sure that he's involved in the transformation of the industry and especially the insurance aspect of it.
Yeah, Gordon Ito is really he's always faced with he's got a tough job, because he has a tough job because he's got the insurance companies that are passing on basically the cost of true health care expenses, but he also needs to make sure that the insurance companies are viable, and so controlling or mitigating increase in rates is really part of his mission, but it's a delicate balance that he really has to make sure that everybody's viable. So he brings a very interesting perspective because he sees both sides of the table. He'll see it, actually three sides. He'll see it from the employer side, the insurance company sides, and the healthcare providers. And everybody's in a tough position.
Talk about complexity.
Yeah, he's got to be King Solomon for sure.
Yeah. Okay, next one is Tom Matsuda, another government person in the office of the governor, one of those special guys in the office of the governor, and he's the implementation manager for the transformation into the Affordable Care Act. What do you think he's going to talk about?
That's right. He's going to talk about generally what the state is doing and how all this plays together. So obviously the governor, as part of his priority, is to really be able to focus on this and really drive dramatic improvements. And Medicaid is one of the largest payers, and is the largest payer in the state, I guess you could say. And so looking out for basically what can we do to really improve the care of government employees, but also in the Medicaid program, and how are we really going to improve and make ourselves more efficient. So he is going to be equally motivated in ensuring that we're going to be financially viable over time. And if we can do that, we're going to do it through improved quality, and how all this plays together. So the office of the governor can bring a lot of disparate groups together, and they certainly have. So we're in constant meetings talking about what these improvements are going to be.
Yeah, we can do this right here at the Plaza Club on Thursday. We can have all you guys talk to each other, eh?
Maybe over a couple of beers as well.
Okay, better. Okay, and then, in addition, I'm skipping you because you're here, but Hilton Rathel of HMSA, he's Executive Vice President of HMSA, has a lot to do with making HMSA take those steps which are, at the bottom line, good for the well-being of every citizen in the state. So a noble purpose beyond just the business of being an insurance company.
Yes, that's right. Actually, I've known Hilton a long time. And what he'll do is he'll talk about the programs that HMSA, but also other insurers are already doing now, such as patient-centered medical homes, which is still part of the same sort of team care approach. Also, how they're incenting providers to be able to work together so that we're not on this gerbil wheel of,
gerbil wheel, you heard it here on ThinkTech. It's something we'd like to avoid. Thank you, Steve.
I'll have to rethink that next time. But this aligning so that if care providers are being reimbursed, that they're really being reimbursed from the quality improvements that they're giving to their patients as much as anything, not just for how many ED visits you got or how many patients you saw in the clinic that day. And
so you shape the way medicine is practiced.
That's right, you really do, with the right incentives. And not do it in a way that's just adding more work to the physicians where they're already overworked. And why anybody would want to be a physician, I just
it's harder and harder, isn't it?
It really is.
Send your kids to law school. I'm only kidding.
Oh, we don't need to go that
I do
far.
not recommend that. In fact, what we need is some tort reform. That would help all of this. Okay, then we have Nadine Tensal, my personal favorite.
Yes.
And Nadine is a solo practitioner in pediatrics, I think, and she practices at Queens, and she's the president of the Independent Physicians Association, which really means that she's a leader among the solos. She can speak for them. No?
Yeah, she really is. Nadine is the heart and soul of everything that we're talking about. I mean, it's she will bring us a very balanced perspective of how the practical nature of what it is that we're talking about and how this really can make a difference.
Yeah, what a panel, huh?
Great panel.
So, what's the dark side? We have a couple minutes left. I'm just curious about what you lie awake at night worrying about. Where could this go off the side? What should the public be concerned about? I mean, a legitimate, rational concern about how this is unfolding.
Well, I think, for us to do this well, it's the innovation that drives, the integration that will drive the innovation. But there's always that issue of, well, how is my information being used, and is it appropriate, and do we have enough protections in place?
Well, just give it to the NSA. It's easy.
I thought we weren't going to talk about
that. And it'll wind up in the waiting room at the Moscow airport, yeah.
Yeah, but I can tell you that a lot of us have been working very hard collaboratively together to ensure that the information is appropriately used, and the real purpose of it is at point of care, and that information should not be abused. And there's certainly enough rules, laws, and regulations that really control how that information is used. So,
what's the risk, though? I mean, really, I mean, we have national security breaches, and that has some kind of effect on the country in general. But so what? They find out I have a swollen Zorch. What does it mean? Should I really be concerned about that?
Well, I think if I mean, that's a very sort of private sort of thing. But there are financial risks if your Social Security number, your date of birth, and all these sorts of things are compromised. Yeah, that's always a risk. And
like identity theft.
Identity theft, yes, absolutely. But that's the sort of burden that we all face right now. If you're using a credit card at any location, you're going to have that same sort of issue. But it is a sensitive topic, and that's actually why I'm reluctant to talk about it sometimes.
Excuse me.
But I will say this too, with the Health Insurance and Portability Act, HIPAA, that was implemented many years ago, we've got a pretty big jump on this already. But the only safe computer, the only safe information is one that's absolutely turned off and unplugged from the wall. And even then, it's not safe. If that hard drive isn't encrypted, it's still vulnerable to theft.
Okay, are you prepared for all the hard questions that are going to come up from the floor? They come in index cards, so as nobody is, behind an uncontrolled mic or anything. But there'll be some difficult questions. Are you ready?
I'm ready. Absolutely ready.
Okay, Steve. Thank you so much for coming down today.
My pleasure.
It's been wonderful having this discussion with you. I'm elucidated at the very least. Aloha till Thursday, man.
Okay, let me go look that word up. Yep, thanks, Jay.
Okay, wait one. He's got a...